want to do is I want to check my care plan, and I'm looking for how much assistance does the client need, what's their name. Okay, so today I pretend I have a male client and a female client. I'm going to show both. And they are wearing an incontinent brief, so that's what I'll be doing, changing the incontinent brief or assessing it. And it's a male, and their name is Mr. Lion. And it's usually only one page. They're a one-person assist. So that's all I basically need for now. I've checked my care plan. And I'm going to do my hand hygiene. Knock on my door. Hi, good morning, Mr. Lion.
Morning.
Okay, can I just double check your name? Perfect. And I'm going to provide my privacy and ensure that my bed is actually locked. Make sure that it is actually locked. Yep, it's locked here. I'll check on the other side and provide my privacy curtain as I go. Today what we need to do is, I'm here, I brought in all my supplies. We're going to do a bath. And we're also going to change all of your bed linen today. But I see that you're on bed rest, so you're not able to get out of bed. Is that correct?
Yes.
Okay. So what we're going to do is, I'm just going to prepare you so that I can do it. And before I do all of that, do you feel like you're soiled?
Yes.
And okay. So I'm going to double check that first. But I'm going to bring the bed up to my height. My name is Joanne, by the way. I'm a PSW here at Yorkdale. How are you doing today?
I'm good. How are you?
I'm good. Okay, so as we do that, I'm going to lower the head of your bed as well. Oops, wrong way. And you can actually do both at the exact same time, right? Just by pressing the two buttons. I got to go all the way to my height, which is basically till it stops. There we go. Okay, so now what I'm going to do is I'm just going to assess your brief. So I'm going to move this down to the end. You can, for now.
Okay.
We're going to move to the side, okay? And what we're looking for is we're going to be assessing that yellow line to see whether or not it's soiled. But you're also kind of going to assess if there's any like odor, maybe they had a BM, and that's going to let you know whether or not you need to change the brief now. If it's really soiled, we want to change the brief, or if they had a bowel movement, we want to change the brief. Okay? So, oh yeah, I think we're going to change the brief now, and then we'll do the bed bath. Okay? So I'm just going to get my supplies ready. So it's a good idea to just give your client a little bit of warmth and privacy. And I'm going to set up my supplies. So for that, we need a new brief. And I forgot toilet paper. Oh, here we go. So I've got a new brief, toilet paper, sanitizer. I think that's all I need. I'm going to put on my gloves. Or you can just verbalize placing your gloves on. And I'm going to place the towel. I can either place the towel now or I can place it right before I do pericare. But I have to remember for pericare, I need soap and I need a basin. I don't need these supplies, so just take out what you need. So before I take the brief off, I'm going to get water, but I'm just going to make sure I have all of my supplies. Okay, so I'm going to put up my side rails because my bed is high, or verbalize that you would lower the bed down to the floor. I'll be right back. I'm just going to grab some water. Okay? So I'll walk over to my washroom. I test my water either with my elbow. If you have gloves on, it's going to have to be your elbow. Or your wrist if you don't have gloves on, and let the client assess. Is it good? Perfect. And what we'll do is, I'm just going to remove this sheet to your knees so it doesn't get dirty. And I'm going to just roll up your gown. That's okay. You've tucked it really underneath, so I'll gently roll you over so I can get the gown off. Okay, we want to make sure we don't contaminate the gown, so we make sure it's out of the way. And we're going to get to this in a second. Okay. So what I want to do is I remove from the far side, right? I've already assessed. I can actually get the client to move closer to me so I'm not leaning so far. That's okay. Right? It makes it a lot easier for me. So I do the far side, put the tabs down, and roll and tuck it in as far as I can. You don't want to open it up too soon because you're just going to get a lot of odors. So I do the close side, same thing, tuck it in, and then tuck it under. So now when we're opening up the brief, we want to take a quick assessment. Is there any redness, like blood in the urine, etc.? And you kind of just take it down, you take a look, and you fold it in and down, like that. Okay, so you want to keep everything inside. And what we're going to do is I'm going to get you to roll over if you can. Excellent. Okay, so now I can do like quick wipes if needed and put it straight into the incontinent brief. Or, depending on what's going on, I might need to remove the incontinent brief first, right? And then I can do the cleaning. Both are correct, it just depends on which one is better. Right? Depends on if there was a bowel movement or not. So I'm just going to tape it shut. You know me, I like to sing. And it goes in our garbage, which I keep the clean one away. And now I just grab toilet tissue, wipe, put it in my garbage, wipe, put it in my garbage till there's nothing visible. Okay, so now I can, if my gloves are dirty, I would change my gloves, do hand hygiene, put on a new pair of gloves, right? Let's pretend there's nothing, it's clean. Now it's really easy for me to put my towel, because she's already on her side, and everything dirty has already gone. So my towel won't get contaminated, and I like to fold it in so the inside stays clean. Right, so that I wipe with the clean part. So now I get to roll the client back over, and my client's going to be a male today, so this is going to be showing, remember, because they don't have on a gown anymore. If I need to, I might still need to get water if it's cold, because sometimes you get distracted or something happens, so you might need to get new water. Here are my cloths. One is for the wash, one is for rinse. So for my male, I've got to switch hands because I need to hold with this hand, clean with the other. Ask your client, before we overexpose, are you able to do this on your own, your pericare? No. The client's going to say no, okay? So what I'm going to do is I'm going to need to pull back your foreskin, right? So gently pull back, that's going to show you the tip of the penis, and you're going to clean in a circular motion. I'm going to do a rinse. Right, so rinse in a circular motion, return the foreskin. Now should you be using soap? Right, I'm going to use a different part of the cloth because I don't want to contaminate. So again, if you need to rechange the cloth, add more soap. Right, we're washing in downward strokes. You really only need to show like 3 times. You need to lift to do the underneath. Really important that you do the underneath. And then we're going to do the scrotum. Okay, switch hands again. Right, in order to do the scrotum, I'm going to lift the shaft out of the way. Right, and you clean from the further side to the closer side as best as you can. Repeat as needed, and then you're going to do your rinse. Right, so I think we showed the rinse of the penis, right? Rinse of the scrotum. And you're ready for your pat dry now. I'm going to use the inside of the towel that's folded in to do a pat dry. Then you can also do the abdominal area or the groin area, right? Wash, rinse, pat dry. So we're gonna say this is done. We're gonna hide this. Down here. And again, pat dry. So can I get you to roll over? Right, we need to do the anal area now. I forget which one is my wash and which one is my rinse. I believe this is my wash. Right, so I put some soap on this. And remember, wrong hand again. So you're gonna lift with one hand, or you can ask the client to lift their own cheek if they can. So they can lift or I lift. If I'm lifting, don't lift with your fingers, lift with your palm, right? Like this. You do one wipe, right? One side of the cloth, flip to the other side of the cloth if you need to do another wipe. You can't wipe anymore with this. If you need to wipe again, you're gonna have to use the other side of the cloth, right? Because in real life, you might need to wipe again. Right, 1, 2. So now I don't need this anymore. It goes into my laundry bag. And I'm ready to do my rinse. Right, so lift, one wipe, that's my rinse. Don't need it anymore. And I'm gonna do my pat dry towards the back, right? So I pat dry from the front towards the back. What I want you to do is roll back towards me. And can you bend your knees and lift your bum up just so I can remove the towel. Don't need it anymore. Goes into my laundry. I'm going to cover my client up because we're done. Oh no, we need a brief. Okay, so I could have not rolled her over. I rolled her over too soon. Go back. Roll back over. So sorry. So now we have the brief. Make sure that the tabs are at the buttocks side. Some of you are still putting your briefs on and the front is in the back, so be careful. It's not going to be halfway up their back. It's really the main part of the buttocks should be at the back of the brief. You need to measure it a little bit just by bringing it up to see if it's actually in the center. And this part we're going to tuck in between, right? So that when the client rolls back over, you can roll back over. Right, we're going to bring that up through the middle. You have to be really mindful of the crease, and this needs to go in that client's crease. You may need to pull the skin, because there's folds in between, to actually get it in the correct position, just like that. Right, so now, which tabs do we need to do? The bottom first, to give it a good hold on the leg. I need you to roll back a little bit. No, just roll towards me. Right? You don't want to pull this because it can rip. So you get them to roll. This is a lot harder to do with gloves on. Right? But it's very doable. Right? So now we have a new brief on the client. I'm going to cover the client up. Right? Cover them up. And I'm going to take off my gloves. There we go. It's going to go in my garbage. I'll just be right back. I'm going to clean up the supplies. Okay, put up my side rails. And I'm going to organize and clean all my supplies. Go to the washroom, rinse it out. Put this back. I want to take my brief now and refold it because the next person will need a brief. And if I run away with it, then they're not going to be able to do their test. So just quickly, I got to tuck these in. So that's just part of what we need to do. Organize for the next.